In this episode, I'm going to talk to you about Peyronie disease, what that is, and what causes it. So I'll see you on the inside, so stay tuned. This podcast is for you, the modern man. I'm Dr. Truong, your host. I'm an intimate health medical doctor and best-selling author of the book Erectile Dysfunction Fix. I'll do a deep dive into sexual health and performance and how it affects men of all ages and backgrounds. So let's get started, and be sure to visit my website at sexualhealthformenpodcast.com for more information and resources from the show. See you on the inside. What is Peyronie disease? Well, Peyronie disease is more common than we think, and sometimes it is unknown. So we're going to dive into it a little bit today, and I'm going to tell you some treatment and some causes of Peyronie disease. If you are watching this on YouTube, you can see my slide. I'm going to try to explain this as much as I can, and so that way you can understand. Peyronie disease is actually caused by inflammation, which is caused by a fibrous knot or like a scar knot that is in the tunica albuginea. The tunica albuginea is a wrapping that wrap around the corpus cavernosum, or the main muscle of the penis, really. And think of a muscle of the penis like a sausage, and it has a wrapping on the outside. And the tunica albuginea is the wrapping for the sausage. What it does is that because it's fibrous, it's not stretchable, when the penis muscle, which is made out of smooth muscle, enlarges from an erection, it is compressed against the tunica albuginea. When that happens, the veins that are in the corpus cavernosum, or the penis muscle, gets compressed, and that's how you maintain an erection. It's almost like the blood flows into the penis muscle engorges, and as it engorges, the muscle is compressed against that fibrous lining, or the tunica albuginea, and then the blood is stopped. It's like the vein, it gets compressed, the blood is stopped from going back outside of the penis, and that's how you maintain an erection. Now, ED happens when the veins are not completely compressed, or that the vein starts leaking. And that's when you start seeing issues of decreased firmness, or you have an erection and then you lose the erection. And the majority of ED issues is really due to inadequate veins being compressed. Now, Peyronie disease is that at the lining where the tunica albuginea are, the wrapping that I was talking about, it's a scar tissue in there. Like a scar tissue, think of a scar tissue like a knot that is hard, that is in the wrapping outside the corpus cavernosum. And the knot, or sometimes called plaques, impair the expansion of the corpus cavernosum, or the penis muscle, to expand. And when the knot is there, it causes the penis to bend. And sometimes the penis can bend down, or can bend up, or bend to the right or to the left. And sometimes it can severely bend from mild to 10 degrees to about 90 degrees, and it could be painful as well too. And there are three stages to Peyronie. It could be an asymptomatic stage, and then going all the way to the painful stage, and to the stage that you see a lot is associated with ED. Now, 60% of patients with Peyronie have ED, but when you start having ED is in the latter part of the Peyronie disease at that time. Other causes of Peyronie disease that is not from inflammation is vitamin E deficiency, taking beta blocking medications like atenolol and metoprolol, and usually used for heart disease or even high blood pressure, and high levels of serotonin level, excessively high levels, and sometimes depression medication raises serotonin level. Now, this is no indication to say that, hey, you have Peyronie, stop these medications. I'm not saying that. I'm just saying that it could contribute to it, and you need to talk with your doctor before you wean yourself off of any medication. And then the other common cause is from trauma, or fracture of the penis, or just trauma to the penis from a long time ago. And Peyronie disease could be genetic. It could also be from Paget disease of the bone. It could be from a condition called Dupuytren contracture. Dupuytren contracture is when you have a knot or scar tissue that is in your palm, and it tends to bend your fingers, and sometimes you can't pull it out, and sometimes you can, and you hear a little click when it goes from when you try to extend it out. And it's also associated with autoimmune, like I talk about, and in conditions such as rheumatoid arthritis. It also can be present in patients that has high blood pressure, diabetes, smoking, and the incidence is between 1 to 8% in men ages from 40 to 70. And this is a schematic picture, the bending of the penis and of the plaque. What you see, the red color and the plaque, that is part of the plaque is what is causing the bending of the penis in the tunica albuginea. And this is on YouTube. You can actually see this. You see the buccal fascia there, and then you see the white, and the picture down below, you see the arrow that's pointing to the scar tissue in the tunica albuginea. And this is the picture that is seen on ultrasound, and it shows up as a white flag at the curvature. And I can actually see this when I used an ultrasound machine to do a penile Doppler ultrasound to assess for blood flow of the penis. But I also look for plaque that are in the tunica albuginea, because sometimes the plaque can be small that the man does not notice it, but I can see it on ultrasound. And this happened quite frequently when I'm evaluating a man for ED, and we look at the ultrasound, we actually see the small plaque that is in there, and then you can actually feel it. And most men can actually feel where the curvature is at. It feels like a knot. It feels kind of fibrous and hard. And sometimes it ranges from a small BB gun type like knot to even like a pea-sized knot as well. And sometimes it will run along the course of the penis as well. And there has been multiple studies that have shown that Peyronie's disease can actually be treated with injections of platelet-rich plasma that I talk about in my last episode. Platelet-rich plasma is the platelets that come from your blood that the doctor will harvest out of your blood and from a centrifuge, and then re-inject it again into that knot that I mentioned that was causing the curvature to be smaller and to break up the knot. So it has been shown in multiple studies that it has worked and that you don't have to live with it. But if the curvature is significant and it does not go away with using platelet-rich plasma or PRP and a combination of shockwave therapy. And if you listen to my episode in the past when I'm talking about shockwave therapy is the machine that actually will use sound wave energy, will break up the scar tissue. If you have such significant Peyronie that PRP and shockwave therapy doesn't improve it, then you should consider surgery. I recommend doing PRP first and at least 6 to 12 sessions of shockwave therapy with the focus shockwave, maybe even on top of radio or shockwave as well too. So stay tuned. I'm going to talk about shockwave therapy and why that is the next innovation for ED. And I'd appreciate you staying with me, and drop a comment down below and let me know whether you have Peyronie's or not. And have you seen a doctor about that? I'd love to hear from you. See you in the next episode. Thanks for listening to the Sexual Health for Men podcast. If you love this episode, then please take a screenshot on your phone and post it on Facebook, Instagram, or wherever you post. And be sure to tag me and let me know why you like this episode and what you like to hear in the future. That will help me know what's great for you, and I would love to give you the most incredible free gift designed to help you improve performance quickly. Go to my website at sexualhealthformenpodcast.com to get the book, The 5 Common Costly Mistakes Men Make When Facing ED. I would appreciate it if you subscribe, leave a review on Apple Podcasts or wherever you listen, and just know that you can have sexual vitality for life. I appreciate you. Until next time.